A new dawn, a new horizon of healthcare delivery and patient safety. We have a goal, a noble drive.
Hand in hand, step by step, we will thrive.
To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion. Standing right by your side. Joining hands for building a vision, shaping a culture for patient safety.
Setting up standards with best foot forward. Won't ever leave no stone unturned.
We wear our pride on our sleeves, walk with passion like a breeze, training people, enhancing their skills, spreading the message of quality healthcare for safer patient care, a better nation.
We have a goal,
We have a goal,
a noble drive.
noble drive. Hand in hand, step by step, we will thrive. To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion, standing right by your side.
So, good morning, good afternoon, or good evening, depending on which part of the world you are joining us from. I'm Dr. Vijay Agarwal, welcoming you. I'm the president of CAHO, welcoming you to this 52nd ISQua CAHO webinar today, which is on technology as the enabler. The moderator for today, it's my proud privilege to introduce Dr. Nitiraj Gandhi, who is a dynamic, result-oriented professional with a proven expertise in planning and execution of, I think, very high-stake projects, both in the pre-COVID and the COVID era, and he has been responsible for delivering 4x growth into the various things that he touches. So he has a Midas touch to him. He's a very well-known professional. He's the managing partner of Medium Healthcare and the chair of the Global Proposal Review Task Force of HIMSS. He's also associated with the Indian Institute of Management at Bangalore. I can keep on talking about Dr. Nitiraj Gandhi, but I'll rather ask him to introduce the speaker of the day today and to so that we are able to listen much more about the topic of technology as the enabler. Over to you, Dr. Gandhi.
Thank you so much, sir. Very kind of you to come from a stalwart like that. Humbled, truly. And thanks again for inviting me for this program. As we are aware, the topic is very important, technology as an enabler. And I think in healthcare, technology has multiple functions to serve. So we have with us our speaker, Gilvane Lolato. I hope I've got the name right. Gilvane is a PhD candidate in pedagogical education from the Pontifical Catholic University of Campinas. She's also an operations manager at ONA, the Brazilian National Accreditation Organization. She's a fellow of ISQua, And she's been the regional director at the Brazilian Society for Quality of Care and Patient Safety. Really look forward to hearing her perspective on technology. And over to you, Gilvane. Thanks so much.
Hello, everyone. Thank you so much for the opportunity to share with you our experience. It's a pleasure to stay here. Congratulations for the initiative because I see in the Zoom we have 94 people participating in this webinar, 94 people. It's interesting and I think it's an opportunity to improve your knowledge or to have an opportunity to have different highlights. Now, in this moment in NONA, we are reviewing the most important manual that we have. We have two manuals. One of the manual is the focus is of provide the services of healthcare, and the other one is the companies that deliver the services in the organization. Nowadays, ONA has more than 1,000 in a health organizations accredited by ONA. And the manual that I will comment in my presentation is the manual that has 98% of these organizations. The profile of the organizations, only for you understand a little bit, is we consider every profiles. For example, hospitals, clinical, laboratory, diagnosis, imagine diagnosis, ambulatory, and the other one. We consider nowadays in Brazil accreditation on his eligibility to the primary care. We call the first step of the organizations, the primary care. The second organizations, when we include the hospitals and the other one, the complex organizations, independent of the complexity, independent of the size, independent of the region. Nowadays, all of the organizations in Brazil is eligibility to ONA's accreditation. I will share my screen with you because I prepare some slides. And I first of all, I will only say something about ONA, about Brazilian system accreditation for you understand more. And we ONA in Brazil in decade 90, Minister of Healthcare chancelled communicated a regulation that say ONA is responsible for developing and managing the Brazilian health quality and safety standards of accreditation. ONA is a unique model, national model of accreditation in Brazil. It's a non-governmental and non-profit institutional certifies the quality of health services in Brazil that focus on patient safety. This is the purpose of ONA in Brazil. And our mission is improve the management, quality, and patient safety care in health sector through the Brazilian accreditation system. We believe the accreditation is one way that the organizations of healthcare have a possibility to improve your process, to deliver to the society security health assistance. Our vision, its vision is we would like to active the society, the preference of the society, the organizations that the society chose to you, for example, receive a tent or to realize a procedure or to have a consultant. We would like the society choose the organizations because the organization has one another accreditation. But nowadays is a challenge in Brazil because the society, the people that live in society don't know who is accreditation. Is a short part of the society. The professional of healthcare understand and know the accreditation, but the common people in the society don't understand yet who is the accreditation and what means the accreditation. What means when an organization is accredited by ONA? And we need to disseminate and communicate more the accreditation in a different language because these people that live in the society we need other language to communicate for they understand the importance of accreditation. Our activities is based on the values, transparency in our actions, individual and collective respect, confidential, continuous improvement, participatory development, credibility, and sustainability. This is so important because ONA in Brazil, for example, now I commented with you that we are reviewing the manual that represented the most part of the organizations accredited by ONA. We have for example, the specialists on the society, the surveyors, the other people, the professional of healthcare participate in these projects. It's a voluntary project, and the values that I say, for example, collective respect, continuous improvement, participatory development, we have an opportunity to apply when we are reviewing the manuals and the other activities, that ONA promote in Brazil. Only for you know, ONA nowadays has 3 recognitions from ISQua. One of them is the organizations, another the standards. These standards that I will present for you is recognition by ISQua, have the recognition by ISQua, and the other one is the surveyors program. And ONA is an institutional member in ISQua, and today, this year, we will participate in, we were amphitryon in ISQUA's conference, and I hope you have a possibility to came to Brazil to participate in with us. And when we look for the numbers nowadays, if we consider in this exact moment, ONA has more than 1,000 health accreditation organizations. In this year, ONA will complete 26 years of history. Is a system that is consolidated during these years. Is important because when the accreditation started in Brazil, imagine in 1990, the people don't know, the profession, the organizations of healthcare don't know what is the accreditation. And it's important we have a possibility to consolidate during this year the methodology and the responsibility of the methodology. And we have a certainly that ONA contribute a lot to the grow up, to the secure patient safety in the organizations of healthcare. If we consider the last year, ONA grow 20%, and if you consider the organizations, the methodology of accreditation is applied in Brazil, ONA is the third largest certifier in the world in terms of volume, considering the methodologies that are nowadays, the international methodology that the people certify in Brazil. We have another process in ONA that we understand is so much important, is the education, because we need to prepare the professional of healthcare, we need to develop the professional have an opportunity to put in practice the accreditation, to understand how I need to do in my organization, how I need to change in my organizations. And if you consider the numbers now, we have 15 million people trained by ONA, and the certification issue it's around a little bit more 5,000. It's so important, these numbers, because representing a Brazilian system accreditation consolidated during these years. This is the manual that I commented with you, the manual that represented the most part of the organizations accredited by ONA. This manual for healthcare provider organizations, this version is 22, and in this exact moment we are reviewing this version that we will launch in January 2026. Okay, and we have in this manual different profiles of organizations, as the same I commented before for you. And we understand that we considering the basis, I will present to you a little bit some numbers for you have an idea. The compliance, how is the compliance of the requirements and the standards in ONA's methodology, and we consider 3,000 surveys to analyze these numbers that I will present to you in this moment. If we consider one standards that we have in the manual, the current version, complies with the safety criterion and procedures for the use of medical devices, wearable, and others. In this requirement, in these standards, we consider the risk manager, the usability and human factors, data security and privacy that is so important, performance test and calibration, because depending on the equipment, we need to have a calibration, a maintenance, but we need the testing together. And training and education in this point, because the organizations of healthcare that has this process need training the people to use the technology. This is so important. And on find the evidence in the organizations, if the organizations have the evidence to presentation about the training and education. Environment considerations, because in the new version of the manual that we are reviewing, we will consider a subsection, especially subsections about the environment and about the climate change. But nowadays, the current version, we have requirements in each subsections that comment about this topic. But in the new versions, we will include in the leadership special subsections to ESG, one subsections for the governance, one subsections for the environmental impact, and the other one is about the social impact. In the new version, we will structure in this format, because we understand that if you have the requirement and distance along the subsections, we don't have the highlight, the staked so much. And in this new version, we understand we need to include these thematics, these topics with more relevance to the people understand more about these standards. The other point is when the organizations need to present the evidences to establish and apply a protocol for identifying patients who can be seen on telemedicine. In telehealth nowadays in Brazil, we have a regulation. These regulations establish the rules about the telehealth, and consider in a current version, and we will improve in a new version this topic, because we understand that the telehealth, the possibility of telehealth, we have a long of journey, a possibility to input and implement along the journey of patients. We consider in these standards patient eligibility criteria, because the organizations need to look for the patients that they have a possibility to attend on telehealth. And if they have a criteria, because depend on the situation, the patient, we started the attendment in a telehealth, and the patient present different aspects that they need to follow this patient to on-site attendment, and the organizations need to present the criteria that they define for this point. We consider here the technology accessibility and competence, clinical assessment protocols, patient consent and privacy. It's so important, this point. Emergent protocols, because we have a possibility the technology doesn't work very well, or the other situation. Clinical documentation, interdisciplinary collaboration. In the manual, current version, and in the new version, we consider a lot of the interdisciplinary collaboration in assistance and in the other process in the organizations. Regular review and update of protocols is so important. We consider and we look for this point the day by day, because in Brazil we have, for example, if we launch a manual, a new version, and we have a regulation or update one regulation, we need to, for example, update the manual, and we need to take care and pay attention with these points. And quality control and performance monitoring is the other point that we consider. And when we look, for example, compliance and not applying, we observe we have at this point we are considering the reviewing manual. We have so much requirements, the surveyors including not applying. In this slide, you observe, for example, not applying 74% and compliance 24%, partial compliance is a little bit 1% and not compliance is 16%, sorry, 1%. It's important to observe this situation because we need to develop more the surveyors. We understand sometimes the surveyors is we need to discuss and include bigger reflections with the surveyors, how type of evidence they will find or they will search in the organizations of healthcare. We need to prepare the surveyors because if we review the manual, review the methodology, and we have a consistent methodology, but the surveyors, the team of surveyors is not prepared for this one, we don't have a possibility to transformation the organizations, to provoke a reflection. It's so important we prepare the surveyors teams to put in practice the honest methodology. And we guarantee the ideas and the plan that we discuss and that we implement, active the organizations, active the people in the organizations too. It's so important this point. The other standards that we have in a current version, and we will continue to consider in a new versions, but we understand we need to update and include other details that we will show you in the other slides. But one other standard is apply a term of acceptance and consent for care in telemedicine platforms. This point is so important because, for example, imagine the patient is in your house and we have other people's in your house, or you don't understand a little bit everything about the telemedicine platforms, and we need to explain, we need to apply a consent process, informed consent process to this family, to these patients, for they agree with this type of attendment. Scope of services important. The organizations define how type of services we will attend in a telemedicine, in a telehealth. It's important they define a criteria and prepare the people, and not only the people and the patients, the family, to use the technology, the researchers, to use the research. And we need to guarantee a private and security, data privacy and security, because imagine if we don't have a total control in the organization on-site attendment, imagine a telehealth attendment, and we need to take care of these points, and about it we consider in the manual. The other point that we include here is patient rights and responsibilities, because we need to explain and say so clear to the patient and your family how is your responsibilities in this process. Emergency protocols, technical requirements and support, language and accessibility. This point is so important, and we understand nowadays about the structures that we have in the organizations is not totally possible, but we need to adapt the infrastructure. For you have an idea, in Brazil, we have approximately 10,000 organizations of healthcare. In these, among of organizations, hospitals, only hospitals, 10,000 hospitals. In these hospitals, we have, for example, 70% of them that have or 100 bed or less 100 bed. And we have a big number of the hospitals that have nowadays more than 50 years, more than 70 years. Imagine your infrastructure, imagine your physical structure. And when you include, for example, the telehealth or the other type of attendment, the research technology research, we need to evaluate and change this structure, this physical structure. But not all the organizations have conditions in exactly moment to do this one. For example, the other point about these numbers that I commented with you, the other point and concern point is about climate change. Because how the organization will change your physical structure to attend or to, for example, minimize the environmental impact. This is a discussion that we have in Brazil in so many forums and events to help the organizations to find a solution of this one. It's not simple, it's a complex situation, but we need to discuss and we need to find a way to help these organizations. The other point that we consider here is review and update the consent form and patient acknowledgement. I comment about it. It's important we consider the patient and your family. Sorry, in this point about the term of acceptance and consent, observe we have compliance 25%, not apply, we have 74%. Because the subsection of telemedicine is not all of the organizations that have it. But we understand we need the point that I commented, we need to develop more the surveys because sometimes is applying, but the survey understand is not applying. This is a point that we are working in this moment to improve these results. But if you consider the organizations that apply this requirement, we have the most part is a compliance, have a compliance in this requirement. When you look for the establish a digital certification system for prescriptions and certificates, this point is a complex point because nowadays the price is so high to implement this situation, this research in Brazil. And here we consider digital signature technology. For example, some professionals of healthcare don't have a digital signature. And the organizations of care, the discussion is, I will provide for them or not, or the responsibility is the professional need to provide. And the organizations need to take this, take these decisions, need to make a decision because it's so important. Interoperability. In Brazil, we have nowadays a challenge in this point too, because we have a public health care organizations and we have a private organizations. And imagine in a journey of patient, the patient pays in different organizations. If you consider only a public organization, okay, you have a unique system. If you consider private organizations that has all the types of process and organizations, for example, primary care, ambulatory, diagnosis, laboratory, hospitals, okay, you are in the same organization. You have all of the services in these organizations, you have interoperability. But when you go to different organizations, this is a challenge because we don't have it necessary in all of the organizations, an integration system, a continuous system. If we consider the registrations of the system, for example, if you go in one organization in Brazil, a network organization, these organizations has your property system. And if you go in the other network has another system. And this system not integrated. This is a challenge nowadays, but we understand the onus is a good way to provoke this integration and continuous assistance. Use authentication and access control is so important because we need in all of the system or the institutions, we need to present the evidence in these points. Audit trails in track and patient consent and privacy, certification authority, integration. Disaster recovery and backup. At this point, the structure, physical structures, the organizations in the last years, if we consider and compare 10 years ago, I say we didn't have the structure that we have nowadays. This point, I consider we have an evolution in Brazil because we have a big risk. The risk is outside is grow up a lot and so fast, and we need to adapt the organization with this point. And patient verification. If you look for the numbers, observe we have a compliance 26% and not compliance 74%. It's the same justification that I said in the other slides. Okay, we have the organizations that don't apply the telehealth system, and or in the moment the surveys don't have a perception that these organizations need to attend these requirements and depend on the situation. The other point that we consider in a current version is if the organization establish good practice for the security of digital medical record information, ensure the confidentiality of information and patient in the organization. patient privacy. In this requirement, we consider the patient education, the physical security measures, employee trainings and as I commented with you in other slides, data breach response plan, backup and disaster recovery in the same point that I commented, secure communication channels, patient consent and control, data minimizations, access control, and authentication. We need to consider this one because, and the discussions that we have nowadays is, for example, about the artificial intelligence. The organization started to use the artificial intelligence, but don't establish a good practice to the professional use, don't prepare the professionals to use. The people that work in the organizations need to understand all of the risks that we have in this situation. Because if we don't prepare the people to use with compliance, the artificial intelligence, the other research, technological researches, we have a big risk in this situation. And in this requirement, if you consider the requirement that the surveyors understand apply, we have a 26% is compliance, but we have a 74% not apply. Observe that the percentage, the numbers is similar in all of the standards that I present for you. About this, we consider changing new versions that I will present to you because we understand that we need to look for the telehealth with other perspective, and I will comment more about it. Other standards that we have, if the organizations establish and implement protocols to use the digital platforms to facilitate the transmission, the information between the teams, patient and family members. And the organizations need to present the evidence if it has this document established, implemented, and the surveyors need conversation with the professionals, for example, the patients, the family, if it is active, this part of the people. Because if you have a beautiful document, but you don't put in practice, you don't attend to the requirement. And we need to consider the document about the communication, the informed consent, interoperability, documentation, record keeping, user support in troubleshooting, regular update and maintains, confidentiality and sensitive information, cultural and linguistic consideration, and audit. If the organization has an internal audit, a systematic audit to check if these standards that the organizations implement, the people have conditions to put in practice, to adherence, because sometimes we have a difficulty when the people don't adhere the process. We have established the organization, established a document, a protocol, but the people don't understand very well what means this document or the importance or the impact, and we don't have a good adherence. We need to work a lot with these points. And if you consider the numbers, look, is similar numbers that the other slides, 25% compliance, 74 not apply. We discuss a lot with the surveyors these topics nowadays because we need to look for this one with the other perspective. Okay, this result is to you understand how we have nowadays in a current version of manual about the technology, about the telehealth, about the researches, the technology researches in the methodology, honors methodology accreditation. Now I will present to you a little bit with the new ideas that we are discussing in the new versions that we will launch in January 2026. For you have an idea, I will explain the differences between current version and a new versions for you understand. If we consider the first section, we have in the manual, in this manual, 4 sections that we commented. Leadership is one section, patient care is another section, therapy diagnosis is another section, and support management is another section. In the current version, in the current version, we have 10 subsections about leadership, quality people, communication, infrastructure, infection prevention and control, and others. And we will change this section, and we will distribute some sections in the other sections, some sections that is in the leadership, we distribute in the other sections, and the other sections we will redistribute in 4 blocks, in 4 subsections. In the new versions, we will have a leadership governance in one sections, and for example, the leadership subsections that we have in a current version, we will include here. The quality, manage quality, for example, we will include here in the other one. The social impact, we will structure a new subsections because we understand we need to focus on ESG in the leadership. And we will, some requirements that we have in one or another subsections, we will bring to this subsection, social impact, and we're creating new requirements that we understand is important included in this social impact. For example, how the organizations of healthcare look for the community that is around the organizations. What actions the organizations of healthcare prepare and implement for help this the community that live around the organizations of healthcare. We will include this type of requirement. And the other subsections in a new version is environmental impact. Is the same. We have nowadays some requirements in the subsections that we have in the current versions, and we will bring these requirements for these specialist subsections that we will comment about environmental impact. We consider ISQua's reference, that ISQua's published a paper, a green paper about this topic. We consider this point. We consider in conversation with the Sustainability Center in Geneva. We have a possibility to change the ideas, to improve the manual. We have specialists in Brazil that help us in this topic because we need a balance. Imagine the number that I commented with you. The most part of the organizations in Brazil have 100 beds or less than 100 beds. We have a big number of the organizations that have an old structure. How these organizations we will change our structure to minimize the impact. Depend on the organizations, don't have sufficient investment, don't have conditions to change the most part of our organizations. And we need in the manual provoke these organizations. Okay, you are in this situation nowadays, but what you are doing the next years, what you are doing to change the situations, to minimize your impact in the environment. And we bring the requirements that provoke this reflection of these organizations. This manual have 3 levels, and we have a possibility to, in the level 1, include plan, discussions, how you consider this topic in the strategic plan. And the level 2, we have a possibility to include the other requirements. In the level 1, you discuss, you structure a plan, but now in level 2, we need to have the evidence that you implemented this one. And the level 3, we need to show the results, about the impact, about how if these actions that you implement minimize the environmental impact. And we discuss a lot with this one because we need a balance. We need to include these points and the other points in the manual. But in the same time, we need to consider the reality, Brazilian reality. Because if you only include all of the requirements in level 1, the most part of the organization don't active the accreditation. But we need to incentivize the people and the organizations, the director, to reflect about this one, to structure a consistency plan and start to put in practice. And the other subsection is the leadership. We maintain that people because we understand is a subsections that we have in a current version, and we understand that there is a possibility to maintain in a new version because it's so important. We prepare the people. We have a criteria to admit the people, the professional, the employees in the organizations because it's so important we consider these situations. This is the most important things that we change in the new manual that we'll launch in the next year. In the section 1, if we summarize, we will destack the ESG in the section 1. The section 2, the focus is on patient care. And here we have a possibility to look into the journey of the patient. In a current version, we have subsections in each process that the organizations have. For example, chemotherapy, nutrition, telehealth, outpatient, surgical, and others. And in the new version, we are trying, because we in this moment we are in review on the manual, we're trying a journey of patients. But a journey of patient, not only in one organization, a journey of patient that we have a possibility to put in practice in all of the organizations. From primary care, we consider in the journey of patient the primary care, the moment that the people that are in the society feeling a different symptoms, and when this person take a decision to go to organizations to search our organizations, to have attended to go to the organization of healthcare. And the other point that we consider in the journey is the moment of the team, the interdisciplinary team need to take a decision. In the other phase of this journey is about the treatment, and the last phase of the journey, we consider the continuous assistance, the continuous care. And when you're looking for the journey, we include all of the types of services from the primary care to the home care, for example, we consider in this journey. And the organizations will need to look to this journey and identify how phase of the journey apply in my organizations, how phase of this journey is responsible, my organization is responsible. And in the section 2, we will consider a journey of patient, a general journey, not a specific journey, not a line of care patient, okay, a general journey. And we will consider specific requirements. For example, okay, I have a general journey. In this general journey, we consider in the moment that the person is in your house, and the moment that the person take decisions, go to the hospitals or the organizations, independent of the type of the organizations, have a diagnosis, start a treatment and continuous care. But imagine in the intensive therapy, we will have a block of specific requirements, because when in the journey, if this person needs a therapy care, intensive care, we have a specific requirements, and the organizations need to look for the journey and need to look for the specific requirements. We understand, we provoke to the system of healthcare integration care and continuous care when you draw the journey of patients. This is so important. We provoke to the organizations, because nowadays we observe each organizations look only for your structure, your process. But no, I need understanding. This patient from societies, from the other organizations, and I receive this patient and I deliver this patient for the society again, or I deliver this patient for the other organizations, and I need to look for the continuous care. We understand that this journey that we are drawn to the manual will help to the organizations look for this perspective. And one important point, we consider the perspective of patients. In the journey, we draw the phases that I comment for you, and the other line, we include in each phase, how is the expectative of patient? What is importance of this patient, of the society? And we consider in this journey. It's a big project, but we are so excited with this program because we understand that we will help a lot of the organizations. And the other point that we consider in these versions that we not considered in the last version is listen the patients. We structure a committee of patients, and we did a meeting with them, and we will have another meeting for looking to your perspectives. And it's interesting because when you conversation with the patients, we observe 3 main words: communication, because they said that the communication in the sector healthcare is not good. The other point is human. human care. We need humanization in the organizations, but we understand that the professionals don't have the humanizations. And the other point that the patient bring for us is about listen. You need to listen more the patient and family. You need to observe more the details. It's so interesting and emotional when we listen the patient and we have a possibility to conversation directly with the patient and consider this one in the manual. Okay, this is the section 2. In the section 3 and section 4 is more simple because we have a support process. That, for example, in the section 3 is the process that need to deliver, for example, results of exam to the interdisciplinary team take a decision to the diagnosis or the treatment. And in this point, we consider a specific requirement in each subsection, and we have we implement a new idea is a transversal requirement, because we have in each subsections nowadays some requirements like, for example, you register the adverse events that happen in your process. This requirement, for example, we repeat in each subsections. We understand that for not to repeat more this type of requirement in each subsections, we create an idea, the transversal subsections. We understand that this one is the best idea. We minimize the requirement and the manual, and we don't need more repeat this type of requirement. And the section 4 is the same because it's the process that gives the support, the process that deliver, for example, the equipment, the materials, the medication, all of this, the adequate physical structure and the other things that is important. And we will do the same. We will have a specific requirement and we will have a transversal requirement and the manual. This is the most important changes that we have in the manual, but obvious we are drawing a new system. We are review all of the rules. ONA has nowadays more than 20 documents that we establish. If you would like, I have a possibility to share with you these documents because all of them is in English and all of them is published. When we structure all of the rules of the system, and we have a big ideas with this one and different ideas, different changes to turn it to transformation, the methodology, more access in the organizations of healthcare. Okay, and when we consider the technology research is when we consider, we discussing nowadays, that is so important, we consider more to the people, to the professional, the employees, the interesting parts, put in practice in adequate technology, information, security, artificial intelligence. We need provoke the organizations to must adequately allocate human, technological, and infrastructure researchers to support information system. We understand that the organizations nowadays or have a sufficient quantity of researchers, but not necessarily prepare the team to put in practice, or don't have a sufficient infrastructure. And we need to provoke the organizations to look at this one. Okay, what the researchers you need? And you use compliance these researchers or not? And the evidence that we have a possibility to find in the organizations, work schedules, availability of personnel or technological researchers. This is one point that we reinforce. We have in a current version this point, but we understand in a new version we need to reinforce. The contingency plans is the same we have in a current version, but we need it because the employees sometimes when looking for the ONA's manual understand that they need the structure, and the surveyors too, because the surveyors go to the organizations and the survey understand all of the things need a contingency plan, don't understand the criteria to decide when I need to implement a contingency plan. The organization will prepare a lot of contingency plan, not the things that is really necessary. And we need to review this point and establish a requirement, a more clear requirement about this situation. And the organization will need to present your risk analysis, and when the organizations analyzes the risks, identify and define the criteria and define when I need to implement a contingency plan in the organizations for guarantee the continuous care and the transparency and the not only continuous, but the integrated care. The other point that we will there we are having a focus, and we will reinforce in the new version, if the information integration. This point for us is a challenge, because the point that I commented, the observation that I commented you in the other slide, but the organizations into the organizations, they have this difficult, because have a different things, system, on-site registrations, technology, and the people don't understand what the means, or use more than one system. And we need to provoke the institutions must ensure the integration of patient client information across different care units. This is so important, and the technology information need to support this one about the electronic system or the other strategy that we will implement. Quality and safety monitoring, we understand that we need to provoke the organizations to structure not only documentation or guiding, but how they will use the quality, how they use the indicators to take the best decisions, to change the things that we need to achieve the different results in the organizations. The other point, established procedure, is in the same point, is the safety, quality and safety monitoring. But here we consider the specific procedures to quality and integrate the system data. We need standardize these points, and we need help the organizations to look for organizations and identify the fails or the points that we don't have standards, and implement standards to facilitate the employees and have different results. And the last point that we discuss a lot is about artificial intelligence. In a current version, we don't have this point, this requirement standards, but in the new version, we understand we need to implement, and we need to provoke the organizations to establish, to implement, and maintain governance mechanisms to the ethical and secure use of artificial intelligence in health process. The organizations need to define institutional policy, guidelines to use to map the risk assessment, to have a consistent documentation, to prepare the profession to use correctly the artificial intelligence, to define a manual of the best practice, because the technology, the research, the telehealth, the artificial intelligence is here. We don't have the other way, but we need a standard. We need to prepare the team to use with compliance at these points and minimize the risk, the impact. The evidence is that we have a possibility to find in the organization is a document of these standards. For example, the training, how the organizations training people, how the organizations update these frameworks or these researches that they have. This point we understand is an important point, and we need to provoke the organizations to establish standards to use intelligence artificial, because we understand artificial intelligence, because we understand that this point will help a lot the professional, but we need to use with standards. If not, the risk is we have a high risk, and no need to minimize the risk continues, but we need to implement the barrier to minimize the risks. This is the point that I would like to present to you. Is an idea what we are discussing nowadays, is an idea what is, sorry, my video. It is the point that we discuss nowadays. Is this the point that we implement in a new version? It's not so easy. It's a complex, is the complexest point, but we understand that we need to improve. We need to update the manual, the methodology to help the organizations. I believe a lot the accreditation have a possibility to transform the organizations of healthcare, but we need to have a consistently and apply requirements and standards. We need to help the organizations to implement all of this one. In Brazil, the organizations of the professional that work in the organizations of healthcare believe a lot in the accreditation, but we that are in a methodology of accreditation need to understand the importance, the responsibility that we have when we structure or when we review the manual. Is a big responsibility because we are delivered for the society a different assistant, a patient safety and a quality process, different results. This is our responsibility. Thank you so much for this opportunity. Sorry about my English because I'm not fluent, but I hope I bring for you different reflections, different ideas for what we are planning in Brazil in the honors methodology. Thank you so much, Dr. Nitiha, Dr. Nahin, and the other people are here to listen me.
Thanks, Gilvane. This was very insightful. And a few of the frameworks that you explained, they were quite unique. The 10-step process and all other things. So I'd
Yes.
just like to open the forum right now in case somebody had questions. So we'll take the questions from the audience first and maybe a few closing remarks post that. Any questions?
In all of your webinars that you organize, you have more than 100 people. I am impressed with this one. Congratulations for it.
I think all credit to the CAHO organizing committee led by Dr. Vijay Agarwal,
Excellent.
who gets younger as each day passes, and Dr. Lallu and the team. So I think the enthusiasm they have, that's what spurs
Yes.
all the members along. So in terms of tech as an enabler, Gilvani, if you could just help, what is the single most feature in technology which you believe will stand out and which will help healthcare going further, whether it is
Okay.
public health or private healthcare? Yeah.
Yes, yes. One point that I understand, Dr. Nichihara, is important nowadays. We have, for example, in 15 days, we had in Brazil Hospitalar Fair. It's a big fair, the biggest fair in the American Latin. And we go there, for example, and visit the standards, visit the companies and conversation with the technology companies. I look for the scenario nowadays and I find a lot of options of researches, technology research, for example, a lot of options. And I put myself in place with a director of a hospital, for example, to take a decision because this director, the leadership, the high leadership need to take this decision to how is the best technology, how is the best research that I will implement in my organizations to guarantee a continuous care, integrate care, and a good assistance. This is, for me, this is the best challenge to the director that is in the organizations and need to take these decisions. And how we have a possibility to help them. I understand that through the methodology, if we include a consistent requirement and the standards to provoke a reflection in the people, how is to analyze the results of the organizations and to identify the profile of patients, who is the objective of the strategic plan, in the assistance, the patients, for example, the patients, how is the perspective of the patients? How is the real necessity of patients? I understand that this director, when need to take a decision to how research or how technology I implement in my organizations, they will take the best decision. But we need help then in these points. I understand that if you have a possibility to help in this type of reflections, we will help these organizations to implement and to implement a digital transformation with a security. But in the same time, we have a big risk and we need to take care of this one. But I understand it is. We have this scenario with the health sector, and we need to help them to take the best decision.
Gilvane, the other thing was data security, and you presented a graph on wearables and the standards they comply with. So anything in your experience, what is the easiest way in which you can help patients identify the right variables? Because they are going to be available on e-commerce platforms or in shops
Yes.
also for varying prices. Now, as a patient, how do I know that so and so variable is actually good for me and some other variable is not is not great? How do
Yes.
you determine that?
Yes, in this point, doctor, for example, I conversation a lot with the profession that work nowadays in the organizations of healthcare, and the challenge with this point is is to analyze it and to understand how the impact this research will have in my organizations. And when we commented with you about the journey of patient, we will provoke the organizations, not only the organizations, but we will provoke the patients. Because when you look with a perspective of patient, we provoke the person that is in the society that don't understand everything to look the information that these organizations will publish and to take the best decision. I think we have the both sides to work in this point, doctor. One point is how the organizations prepare the people that is in the society, that live in the society, and how my organizations will bring the best researches, not only to offer to the patient, but to guarantee a continuous and a safety care. It is a challenge at this point, doctor, but this is my idea. The organizations need to focus in 2 points. One point is information, give the information, disseminate the information to the people in the society to take the best decision, and who is the best way for my situation when I am a person in a society, and when I am a director, we look for this necessary to take the best decision. I think at this point is, doctor. I don't know if I answer your question, but I think it is.
I think there was one
Can,
question we have from the audience. Any standards
okay.
related to use of AI? Use of artificial intelligence, any standards?
Yes, in the current version, no, but in a new version, we will include one standards when I will ask the organization how you use the intelligence artificial. If yes, how you structure a document, you define a best practice to use. For example, doctor, one day I was in organizations, I went in organizations, and the people commented me with I take a decision, Gilvane, is a good decision. The people so happy about this one. We implemented my professional use ChatGPT to write an email or to answer the patient. And I said, oh, excellent idea. But you define the best practice to use the ChatGPT. You define a rules to the professional use. You prepare your professional to use this one. And they stop and said, oh, Gilvane, I don't think this one. I don't prepare. I don't have a document. And I said, you understand, for example, ChatGPT or independent of the intelligent artificial, you understand is a platform, is outside platform. And you understand if all the information that you include here in the ChatGPT, if you include, for example, the name of patient, because if you answer the email of patient and include your name in the ChatGPT, this, you don't have security information. You need to establish a barrier. And the people stop and said, my God, I don't think this one. And we understand in the manual, we need to include a requirement to understand about these folks. Okay, the organization, you implemented the best practice, you define the criteria to use artificial intelligence, and you prepare the professional for it. These points, as we understand, is so crucial, we include in the new version of the manual.
Nitiraj, you are muted.
Thanks so
Yes.
much. I think we've exceeded our time. I'm handing it over to Dr. Vijay for any closing remarks. Thank you so much, sir. Again.
Oh, no, it's definitely a very, very important topic. And very soon we are also preparing for our healthcare technology conference, which will happen in November. So I'm sure that whatever has been discussed today will also be very useful for us to draw up our academic program. So thank you very much. And I think with this, we would like to, Prakash would like to present her with our certificate of our appreciation, which will be, of course, mailed to you. And we are extremely proud that you could be here with us today and your contribution as a speaker. So thank you so much, and please do accept it with all humility.
Mad, it's our pleasure. Thank you so much for the opportunity, because for us it's so important having this opportunity to share our experience, our challenges, because it's not a good positive results, but we have a big challenges too. And it's important we know the other reality to improve our process, our methodology. I think if you have a possibility to change the experience, we have more ideas and different ideas to change. Thank you so much for this opportunity. If you would like the other moment, we are here. And if you would like, I send it to you, the rules, the guidelines that I comment, I send it to you per email, okay? Thank you so much, Gian. It's a pleasure.
Some of us will meet you at ISQua in Sao Paulo.
Excellent, excellent. Thank you so much.
Thank you so much. So yes, so also to announce that our 55th webinar is on sustainability in healthcare, and the speaker is Mr. Peter Henry Carter, who is a board member of the Northern NSW Local Health District. So please block your dates, and this is again a very important topic, and in today's date, we all need to get sensitized about sustainability, not merely from the point where it's not a fashion statement, it is also to make healthcare more affordable and to make it more focused. Everything comes under sustainability, the lean management, how do you do more prevention rather than cure, many things. So let's listen to. Then, of course, our ISQua fellowship. There is a discount which can be availed by CAHO members, and in fact, the fellowship people who are fellows, they just have to attend CAHO-Con conference to continue remaining a fellow. And our CAHO monthly quality meeting, which was organized, we try, and a lot of our hospitals are broadcasting this webinar into their auditoriums. So today, we are very glad that Vijaya Medical Educational Trust in Chennai, Mehta Hospital, Chennai, Ganga Hospital, Coimbatore, Medica Super Speciality Hospital, Kolkata, Fortis Hospital, Mohali, Rajgiri Hospital, Kerala, Baby Memorial, Kozhikode, Kerala, Bethany Hospital, Shillong, Sri Ranga Hospital, Chengalpattu, AJ Hospital and Research Center, Mangalore, Bombay Hospital, Mumbai, Nirmal Sai Hospital, Chennai, Jabalpur Hospital and Research Center, Madhya Pradesh, Christian Medical College, Vellore, and Kaveri Hospital, Vadapalani Institute of Neurosciences, Kolkata, West Bengal. All these hospitals, and of course, also Medical Super Speciality Hospital, Kolkata, Nazareth Hospital, Shillong, Christian Medical College, Ranipat Campus, Sagal New Hospital, New Delhi, and ILS Hospital, Damdam, Kolkata. So thank you very much, all these hospitals who have taken the pains to spread this message of patient safety. So thank you. Today we could not get Dr. Fabio, but we're very glad that Madam Lolato can join. So we have some announcements for our training programs, which is on antimicrobial stewardship, which is on 5th of June, certified professionals in healthcare quality, a preparatory course on the 6th of June, and risk management in laboratories on 7th of June. Yeah. More training programs, quality implementation in hospital, basic program is there on the 7th June, and the 11th June, there is on 5S, and then NC closures on the 14th June. Then we have on 17th June, master training program on healthcare communication. lean management on 22nd June, and patient safety basic program on 5th of July. On-site training programs are there on basic nursing communication on 6th of June at Hotel Residency Towers in Pondicherry, and quality implementation in hospitals advanced program is there on the 19th June at the Chirai Beach Resorts, Kochi. So our continuing diagnostic education series is going to be on anemia and investigations on 3rd June. In fact, it must be happening today. Then the CQE series is going to be on patient-centric sustainable supply chain management on 28th of June. Then masterclass series on empowering clinical excellence and clinical indicators. It is on 4th of July and will be again virtual. CAHO National Certifying Examination for Infection Control Professionals. Batch 5th is coming soon, and hope that more people are able to join. The CAHO Excellence projects are there. Awareness and compliance and excellence for CSSD registration is open. Endoscopy safety audit and facility evaluation registration is going to open soon. And enhancing infection control practices and antimicrobial stewardship compliance registration again is going to open soon. So thank you. As you can see, we have plethora of training programs and activities. CAHO, friends, is not an organization. CAHO is a movement. CAHO is a movement which wants to strengthen the accreditation system by imploring that let's become accreditation ready on any given day, not on the day that your things are pointed, but let's be ready for accreditation on any given day. So thank you very much for joining and being a part of this movement. Thank you.
Thank you. Thanks, everyone.
Yeah, thank you, Dr. Nitiraj, for moderating this session, and Dr. Gilvane for being the speaker today. Thank you, everybody. Thank you so much. Yeah.
A new dawn, a new horizon of healthcare delivery and patient safety. We have a goal, a noble drive.
Hand in hand, step by step, we will thrive.
To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion. Standing right by your side. Joining hands for building a vision, shaping a culture for patient safety.
Setting up standards with best foot forward. Won't ever leave no stone unturned.
We wear our pride on our sleeves, walk with passion like a breeze, training people, enhancing their skills, spreading the message of quality healthcare for safer patient care, a better nation.